Welcome everybody. This is Conversations with IU Northwest Community Partners, and my guest today is Kellie Bittorf, who is the Executive Director of Lake County Community Corrections. Welcome, Kellie, and thank you for joining me in this conversation. First of all, let me ask you, are you okay? We're going to record this meeting so that our students and community partners can actually watch it later on. Is that okay?
Yes, it is.
Thank you for consenting. And now I'm going to ask you, so please introduce yourself and let us know what you do and what Community Corrections does in Lake County.
Thank you. My name is Kellie Bittorf, and I'm the Executive Director of Lake County Community Corrections. I've been here for 14 years, and Community Corrections, we are we provide services to adults, males and females, and we have work release and electronic monitoring are our two main programs, and provide service to a variety of populations. For example, we have direct commitments. They are ordered directly to our programs, and then we have split sentences, so they may serve some portion of their sentence to with the Department of Correction and then come do the remainder of their sentence in community corrections. Some are probation violations or parole violations, so we partner with both probation and parole. And then we also partner with 3 courts and have problem-solving courts. And those are Veterans Treatment Court, Therapeutic Intervention Court, which provides service for those who have mental health issues. And then we have our Community Transition Court, which is reentry court. So those offenders are coming out from the Department of Correction, and we're helping them transition into back into society. So we have, again, a wide variety of offenders that we serve, and most start in our work release program and then transition into their home community and will be monitored through electronic monitoring. And it's a stair-step process, and then eventually with no monitoring, without electronic monitoring, and eventually will be on their own. So we help them get jobs, we provide cognitive behavioral treatment, substance abuse treatment, whatever their risks are. We identify their risk and needs, and we provide case management, and it's a whole array of services that we provide.
This sounds like a very important work that you guys are doing there at Lake County Community Corrections. What is the current population of men and women right now? Currently,
we have around 325.
In total?
Yes.
So obviously, I expect a small group of women and a much larger group of men.
Correct. Yes, we always have a lot more men than women. Absolutely.
Okay. So we are going through unprecedented times. People ask us about the correctional population for both correctional facilities and community correctional facilities, work release programs, but not much is being said in the news. So media is focusing more on the general population, obviously, but we're interested, and our community partners and students are very worried about what's going on inside the institutions of corrections. So I'm going to ask you a few questions about the current situation with COVID. The first question is, how is community corrections facing the current pandemic?
Well, it's been a challenge, very challenging for us. In the beginning, we have our facility is a work release facility, and so immediately we had to make the determination: do we allow people to continue to go to work? And then, you know, with that was the risk of allowing people to be out and possibly contracting the virus and then bringing it back into the facility, which would spread quickly. So we made the decision, an executive decision, to place everybody on lockdown in the very beginning, and which caused a whole nother array of concerns, because then people weren't allowed to leave, and we have people not working, not generating income, and we're not collecting fees, and people, the clients are frustrated, and so then we have to figure out ways to keep them occupied. So, but in the end, we were able to communicate with them and help them understand the importance of keeping everybody healthy and safe, and it's all worked out. We just last week started allowing people to go back to work, and it's working out okay. It's, you know, it's a little nerve-wracking, but we're doing the best we can. For those who are at home on electronic monitoring, we had everybody basically on lockdown as well, except for those who had essential employment. Basically, we just followed the stay-at-home order, same as the governor, and everybody was required to stay at home unless they had essential employment, like I said. With us, for as employees, it was difficult because, you know, for Lake County government, most were allowed to, employees, Lake County government employees were allowed to stay at home, and because they're non-essential employees. But for us, corrections, we had to come to work. So, you know, it's, although we're proud of that, you know, we're essential employees, we're glad that we have that title and we take pride in that. Some days it's difficult, you know, it's a lot, and there were days that were very frustrating and tiring. And then we have staff who either had family members who were dealing with health issues, and then they had to stay home. So we had low staffing issues like that. Fortunately, we didn't have any positive cases, and that's what we were very proud of. We were able to not have any issues within the facility, and that was our primary goal, to keep it out of the facility.
That's excellent. And you are frontline workers and you're essential workers and heroes, and we don't hear this in the news. And this is one of the reasons why I wanted to connect with you, because I think people should know that correctional facilities have been closed and people are still going to work and supporting the clients. So the second question is about the challenges that you encounter with the lockdown and social distancing within the facility. But you addressed most of these questions already in the first part of our interview. So I'm going to ask you a slightly different question. Was there any pushback from the family members who could not visit during the lockdown?
Not too much. We were able to, we allowed the clients to use well, they have telephone access, and so we gave them, you know, more time to use the phone. And then we did provide the clients with tablets, and it took a little longer because we didn't have the Wi-Fi access that they needed. So we had to expand our Wi-Fi, so just the technology. But we did purchase like 20 tablets, and now we have expanded visitation through tablets, so with the technology, and allowing clients to meet with their family members through video conferencing at no cost to them. So that's how we're doing that. It just took a little longer than what we had hoped, but just because family members and clients know that we're doing that and making the effort to do that at no cost to them, people are okay with that. I think just making the effort to do things, even small gestures, people are happy with that. And when people don't have the phone cards, because clients have to purchase those, you know, we allow them to use the phone at no cost. When we make those kinds of gestures, they're okay with it.
I think that's primary necessity. So it's considered staying in contact with the family members is primary necessity, and you guys are doing a great job. And I think these are not small gestures when you talk about providing tablets. We're very happy that this is happening and that people who are on lockdown are being served well.
Right.
So, so talking about the resources that you guys have, was there any scarcity during this pandemic? Was there any current need that was not met because of the situation?
We had a difficult time obtaining masks in the beginning, and sanitizer. Just, I think it was across the state.
Mm-hmm.
And you know, the wipes, the Clorox wipes, all of those things. In the beginning, it was really difficult obtaining ample supplies, so we had to be really careful. Lysol, we're still having a hard time getting Lysol. So just making sure that nobody overused those items. We never really ran out. We just had to make sure that people didn't use too much of it.
And I know that your facility has been always very clean, because I visit your facility very often and it's always sparkling clean.
Thank you.
So I expect to be even better now.
Yeah.
But how about testing? Was testing a problem inside the facility, or you guys did not look for testing?
We didn't look for it, but we have had no problem sending, if anyone requested it, to send them to testing.
That's wonderful.
Yeah.
Okay, so you contacted the health department and then asked for testing, and that was done within the facility.
They were able to refer us because we're essential employees. They've been able to refer us to a place to be tested. It's not been a problem at all.
That's great news, and I'm sure that the people listening to this conversation are feeling better about this, because that was one of the concerns I heard in the community.
Yeah.
So thinking about the possibility of another public health crisis, it's not that we want another public health crisis, but we know that this virus might come back, or we have to be prepared because other issues might arise. Can you provide some public policy recommendation that will help prevent some of the problems community corrections is experienced in the last few months? Is there anything that could be done better so that we prepare in case something like this happens again?
Well, you know, I think just looking back, and it's always in hindsight, that we knew this was coming and we didn't listen really well. Because I remember actually going, excuse me, to the doctor, to my family physician with my son, and we were talking about it, this virus, and just in general, it was like a couple months prior, and really none of us were talking about anything, the potential of what could be coming up. And just really I think everyone could have done a much better job preparing for it. And then all of a sudden it hits and bam, we're all scurrying around, and just being much more proactive and listening better. And I think just the arrogance of Americans thinking it's not going to happen to us.
It's like we all felt invincible, right? Like, this is not going to happen in 2020. Come on, like, this is not going to happen.
Exactly, yeah. And now too, I think just learning how much we can do too with technology. I mean, like now we're meeting here, and there's a lot that we can do. We don't necessarily, and I don't like it. I like being with people and together, but there's a lot that we can do to prevent, you know, with the social distancing, and even with the clients. I mean, they can meet, although I know they like the in-person contact, Even with the video conferencing, we're doing our court. We just started doing court, our problem solving courts. We did them all video virtually. So you missed that. This is allergies too, by the way. You have to like clarify that all the time now.
You're not worried.
I think there's just a lot of things that we can do better.
So how about the social distancing, Kelly? Did the clients complain about the social distancing because they couldn't mingle too much and socialize within the facility?
You know, with the way our facility is set up, we really weren't able to separate them a whole lot because you know how our we didn't have a lot of options. But so how we did it is we kept staff distanced from them because the staff were the ones going out in the community and coming. Right. So we made sure that staff were really prepared, you know, and they had the mask on and kept 6 feet distance. The clients weren't the risk. They stayed in, they didn't go out. We did make sure that to keep them, you know, every day it was really nice. We'd get them outside, and that's when I would go out and mingle with the clients. But I would still keep my distance, but go out with them instead of normally I go on the post a couple times a week and visit with the clients and chat with them. But you know, I stopped doing that because I didn't want to put them at risk, even if I had a mask on. So the contact with the clients really was reduced just primarily with custody staff, and then case managers, even that was reduced. We tried to minimize that contact as much as possible. So that was really a downside too, because the clients didn't get to see the staff that they needed to see as much. But
case managers are so important in what they do with each one of your clients, right?
Right.
So that would be one of the main challenges probably for them.
Definitely. Yeah, they really weren't.
I'm sorry.
They really weren't receiving the service that they needed to be receiving as much as they needed to be. And we still don't have service providers coming in at this time. We're gonna revisit that in the beginning of June.
And that's for safety measures for the clients.
Yeah.
It seems like you are all doing a fantastic job, and we're very proud of Lake County Community Corrections, especially hearing that you have been able to prevent the spread of infections, and you have not had cases inside the facility. So this is really good news for the community, because I know that a lot of people are concerned. So we want to thank you very much, and for the people following us, I want to say that we all thank you, Kelly, and Lake County Community Corrections. If people have questions, they can, for Kelly or anybody else in Lake County Community Corrections, they can send the questions to me at msolinas@iu.edu. Also, please follow us on Instagram, #SPIA IU Northwest. So thank you, Kelly.
Thank you.